Good afternoon and welcome to the February 9th Community Update. My name is Stacy Wood and I am a Public Information Officer here with Buncombe County Health and Human Services. Today we have Stacy Saunders, the Buncombe County Public Health Director, here to provide an update on the COVID-19 response in Buncombe County. As a reminder, this broadcast can be viewed in real time in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. So we'll go ahead and get started with an update from Stacy Saunders.
Good afternoon, and thank you for joining us today for the COVID-19 update. As of today, we've identified 14,193 confirmed cases of COVID-19 since pandemic start. And sadly, there have been 270 COVID-19 related deaths in our community. Our new cases per 100,000 per week, while still at a high level, have decreased significantly since the beginning of the new year. Our current new cases per 100,000 per week is 277. This is roughly a 33% reduction in about 4 weeks. Currently, we are seeing about 70 new cases per day on average in our public health workflow. This is a decrease from 98 cases per day on average just a week ago. In addition, our percent positivity continues to decline and is currently 5.6%. While this is higher than we would like, our percent positivity is approaching the desired 5% or less. Hospitalizations in the region continue to decline. Currently, about 8% of area inpatient beds are occupied with COVID-19. This is a considerable reduction from just 3 to 4 weeks ago. Overall, the metrics we monitor for our community continue to trend in a more favorable direction. As we find the epi-curve bending and the surge dissipating, we have been made aware of the B117 variant that originated in the United Kingdom is circulating in our community. The Centers for Disease Control and Prevention conducts random surveillance on COVID-19 test samples for potential variant strains for better understanding of what is currently circulating. The first known case of B117 in North Carolina was identified in Mecklenburg County and announced on January 23rd. Through the CDC Sentinel surveillance, 3 cases with B117 variant have been identified in our community. Here in Buncombe County, typical case investigation and contact tracing occurred at the time of the initial COVID positive result for each of the cases. Please understand that further sequencing occurs after the initial test and positive result and may take up to a couple of weeks. As such, each of these cases has since been released from isolation. 21 B117 variant cases have been identified throughout North Carolina using the surveillance process. At this time, there is no evidence that these variants cause more severe illness or increased risk of death. New information about variants is emerging. According to the CDC, the B117 variant is more highly transmissible. Early indications show that the Pfizer and Moderna vaccines, the same as those that we use here in Buncombe County, are effective against this strain of the virus. This variant is spreading throughout the United States and in counties throughout North Carolina. We expect to see more B117 in our community as transmission rates of COVID-19, while declining slightly, continue to indicate that there's heavy community spread. While this may seem alarming, we want the community to know that it is not unexpected. This is often the nature of viruses. They look for ways to survive. And it is our job, yours and mine, to ensure that they don't get that chance by following precautions. The same measures that are good at stopping the spread of the initial novel coronavirus are just as good at stopping the spread of variants. This means we must remain diligent in our practice of the 3 Ws, including continuing to wear our masks, keeping 6 feet apart, washing our hands, and continuing to limit our interaction with others. These simple precautions will remain very important, especially as vaccine rollout is still in its early stages. Since December 22nd, Buncombe County Health and Human Services Public Health Department has been vaccinating members of our community with help and support from Buncombe County Emergency Services and other partners. To date, Buncombe County Public Health has administered over 16,400 total vaccinations. About 80% of these are first doses, and the remaining portion represents second doses. Currently, we are receiving 1,950 first doses of vaccine each week and are scheduling about 2,000 appointments each week. Vaccine supply, while we have seen an increase in our weekly allocation, vaccine supply remains very low. Since implementing our first vaccine clinics back in December, we have worked to improve appointment scheduling, including the implementation of a waitlist process for the limited vaccine supply we do receive each week. The waitlist is open to those in current prioritization groups. At this time, Group 1, healthcare workers, and Group 2, individuals 65 years and older. If eligible for one of the vaccine groups, individuals can call 828-250-5000 or visit buncombeready.org to get on the wait list. The demand for vaccine is very high right now, and vaccine supply remains quite low. Currently, we are working to schedule in the range of 6,000 to 8,000 on the wait list, leaving around 40,000 remaining on the wait list. With our current supply levels, we are scheduling about 2,000 new individuals from the wait list each week. We understand the community has many questions about the wait list. We are contacting people based on the order in which they signed up. Please do not sign up for the wait list multiple times. When people sign up for the wait list multiple times, it slows down our process and creates more work for those scheduling the appointments, and also leads to confusion. If you need to remove your name from the wait list for any reason, please email ready@buncombecounty.org or call us at 828-250-5000. Please continue to be patient as we work through the wait list. If you are having symptoms of COVID-19 or believe you've been in contact with somebody with COVID-19, please get tested. You can check out Find My Testing Place website to find a location near you. We do have a new testing provider in our community. Buncombe County HHS has worked with North Carolina Department of Health and Human Services to establish additional testing partners in our area. And beginning February 4th, StarMed, a testing partner of the North Carolina Department of Health and Human Services, began testing in our community. StarMed has set up a testing location at the Buncombe County Sports Park on Thursdays from 10 a.m. to 3 p.m. You can find out more about this new testing partner at starmed.care, including pre-registration for upcoming events. We continue to have a high level of testing occurring in our community. In addition to StarMed, many pharmacies, urgent cares, and other providers continue to offer testing. Buncombe County Health and Human Services and Emergency Management continues to offer testing at AB Tech on Sundays from 1 p.m. to 4 p.m. You can find out more at buncombeready.org. We have been fighting COVID-19 for almost a year now. It has been a long and hard fight. I know many of you are tired and very much want to leave COVID behind. We do too, but we still have a lot of work to do in order to rid ourselves of COVID-19. Our vaccine supply must increase in order to meet the needs of our community and others in our state. And until vaccine supply is ample and sufficient and folks have received their complete series of vaccine, we must remain true to the 3 Ws: Remember to wear your mask, to keep 6 feet apart, and to wash your hands. Please do your part to stop the spread. Thank you so much for your time today.
So in conclusion, we are excited to get into the second part of a two-part Let's Talk series tomorrow evening at 5:30 p.m. In this Let's Talk series, health advocates will take a deeper dive into the science behind the vaccine. The Let's Talk can be viewed here on Buncombe County Government's Facebook page and in Spanish on the Buncombe County Health and Human Services Facebook page. Thank you for tuning in to today's community update. Stay safe.